Dr. Jeff Harp from Highland Family Medicine is back with us. Doctor, as always, good to see you.
Likewise.
Our topic is prepping for a colonoscopy. Great topic for the holidays, right? All right, let's start with the basics here. Why do we need one? Why have a colonoscopy?
So colonoscopy is a screening test for colon cancer. So screening test is basically a test that detects something before it becomes a major problem and while something can be done about it. So a colonoscopy actually not only looks for cancers, but it looks for precancers. So precancers can be removed and prevent the problem completely.
Critically important, obviously. What's the schedule for it?
Generally, people should start at age 50. People with a family history of colon cancer might be recommended to start earlier, but at age 50.
Okay. Are there alternatives to the colonoscopy? Because obviously it's an invasive procedure.
There are, and you'll see them on ads on television and so forth, but the trouble with those other screening tests is that they really only detect cancer, not precancer. So colonoscopy is really a little bit better test because it can detect and remove precancers to prevent the cancer from developing in the first place.
All right, so obviously there's more information that can be gleaned from it. What does the procedure involve?
So the procedure basically involves a scope, a tube about that big around, being put through your rectum all the way through your large intestine. So on me, from here all the way up around here and down here. Wow. So it's sort of like a big U that it makes.
Okay, so there's a lot to it from that standpoint. How does a person prepare for this procedure?
So basically, in order for the gastroenterologist to be able to see what's going on, the bowel has to be empty. So there's a lot of different ways that can be done, but basically I brought an example here. Your gastroenterologist will give you a kit, which generally involves some amount of stuff in bottles that you have to drink, and then drinking lots of fluid afterwards.
Okay.
People pretty much have to just drink clear liquids for 24 hours or so before, and might have other directions about what they can and can't eat for the few days before.
Okay, yeah, so there's a limited diet as well. Let's talk about if there's pain involved here. I mean, I feel like I know the answer to this one, but what level?
Right, so the procedure is uncomfortable. Most gastroenterologists will offer sedation, in other words, putting you sort of in twilight sleep so that you don't know what's going on. But many people opt to have no sedation and sort of watch what's happening. It's uncomfortable for about 10 minutes, feels like bloating, cramping, and then that sort of gets better. So talk to your gastroenterologist about that.
What about afterwards? Any sort of after effects?
After effects, if you have the sedation, you might be groggy. Even if you don't, you might sort of feel a little bit woozy, and it's really should have somebody else there to meet you and take you home afterwards in case you're not feeling so well.
Okay, good advice there. And again, if there's any uncertainty about this procedure and whether you're a good candidate for it, there's an obvious step to take, right?
Right, just go to your primary care clinician and have a conversation about it.
Okay. Thank you.
Sure.
Good to see you. If you missed any of our conversation on colonoscopy, we will share it online as well, as always, at rochesterfirst.com.